Hi, my name is Inga Thompson. I am the Present Secretary of the Prevention of Senior Abuse Network here in Simcoe County. COVID-19 has impacted us all over the world in many ways this year, but it has particularly had an impact on seniors, their caregivers, and healthcare providers that are trying to support them. Today we want to talk about how those three have been impacted by COVID and the impact that it has with regards to elder abuse. This is the last in a series of looking at how COVID has impacted on seniors, caregivers, and healthcare providers. Healthcare providers have had to change the way that they are able to support seniors over the last year. There's been reduced contact with them. Seniors and their caregivers are not able to come into clinics, not able to come to appointments. There's less likely to be home visits being made, and so healthcare providers are not seeing seniors as much as possible. They're also being pulled in many directions. All the different pressures of the policies and the procedures that are changing and constantly changing, and they have to adapt to this. What you did last week may have changed as to how you do things this week. For many, especially those working in the community, there's been a concern about the access to personal protective equipment and gear, masks, sanitization. Some people don't necessarily always understand exactly how these should be used and could be used. And of course, they may have their own fears about the virus, about possibly bringing the virus in to these seniors. Unfortunately, when we stop seeing people, we can end up having this out of sight, out of mind. And so we can often forget about the seniors that we supported a while ago. So what do we need to do as healthcare providers? Well, where possible, try and continue to see people on a face-to-face basis, but do so safely. If that's not possible, then as healthcare providers, it's our responsibility to try and assist our seniors in being able to access our supports virtually or over the telephone, making sure that they're comfortable in knowing how to use this. That may take a little while to do, but take the time, take the effort, take the energy to do that. We need to check to make sure that they're okay. When we do talk to them, it's like having a window into the home. If you talk to them over the computer, if you talk to them over the Zoom call, then check, see how they're doing. Make sure they're feeling safe, sure they're feeling secure. Look at them, observe how they're dressed, observe what's around them. Make sure that they're comfortable. Do the same for caregivers. Sometimes what happens is we have one call and at the same time we talk to the caregiver and the senior together. If need be, have separate calls. The caregiver may need to talk about how they're feeling and how they're doing. Remember, they may be the ones who are being victimized. If you have someone with dementia, for example, sometimes they lash out and the caregiver is struggling with this. As healthcare providers, we're here to support both. So make sure you have an opportunity to talk to both of them. Support the caregivers by helping them access resources as well. Offer them counselling. Offer them problem solving, resources, referrals. If you know that there are other supports going into the home or other supports that they're given, with consent, make those contacts. Work together. Ensure that everyone is aware of each other and aware of the roles that they play. And if possible, make unscheduled calls. Just call on the spur of the moment just to see how they're doing. And share resources. If you know something that's going to be helpful for them or for the senior or for the caregiver, then share the resources. Be aware of what's out there. Sometimes as caregivers we forget what we know and we just assume everyone else knows it too. So take the time sometimes to just sit back and think about what are some of the things that you regularly use that other people would find helpful to be aware of too, and pass it on. We need to reduce ageism. We need to be aware of how we speak. We need to reframe our language at times. We fall into the us versus them, the victim versus the savior mentality. That's a vulnerable framework. That comes from a place of someone else being more vulnerable than we are. So replace that with the framework of social prosperity. We're all in this together. We have strength when we're interconnected. Don't use crisis language. We often talk about the silver tsunami. But when we use language like this, we create fear and we create a sense of helplessness. If we recognize there's a problem that exists with regards to elder abuse, then define it. Don't just state that it exists, but talk about why does it exist? What can we do to solve this particular problem? Be part of the solution. Be cognizant about person-centered language. We often talk about the elderly. And when we talk about anything that starts with a the, then we create stereotypes and we create biases. So be aware of that when we do that. But don't demonize things. Be aware that when we do that, again, we create these barriers between them and us. If we talk about ageism in healthcare and the fact that it's always been there, then it makes healthcare seem like the demon. And remember that how we frame things now will help define how things are in the future. We need to have faith. We need to believe that things can get better and will get better, and there's going to be ways of doing this. So have faith in the future. As I mentioned earlier, we need to look at how we strengthen society. We're all responsible for this. We need to ensure that where we can, we help create some of those policies and those procedures that need to change. We can help by involving seniors in our decision making, in creating the future as to how we do things. We can look at developing programs that strengthen those collaborations. And we can help and assist in educating society by talking about this, by making sure that elder abuse is on agendas, elder abuse is talked about. We have a responsibility as healthcare professionals to make sure that we are doing what we can do to support our seniors. Again, just make sure that you consider the future. Think about elder abuse as being something that should be on your agenda all the time. Something that should be in your mind, being observed, being assessed for, being identified. Make sure that when you're around seniors that you are seen as a safe person, that you are giving them a safe place, that they can talk about this. So if you're not comfortable about this, develop the skills. Attend counselling training to help you identify and speak about this, ask the questions. And regularly educate and inform. So as healthcare providers, we do have the opportunity to make a difference, to make a change, to identify elder abuse, support our seniors, and support our caregivers. Abuse can happen unintentionally, and it's often because of the stress that people are in. So think about that. Don't judge, just support. Thank you.